Our objectives for this topic include what is a circumcision, why get circumcised, why not get circumcised, and what will be obtained before a circumcision. A circumcision is an optional procedure usually done within the first 48 hours of a male child's life. It is a permanent procedure that cannot be reversed, and it is when the foreskin is surgically removed from the end of the penis. This procedure is always performed by a doctor or a trained provider. It can be painful, but there are pain medications that are safe and effective. And if a parent is unsure or scared about their child feeling pain, you can always ask your provider what they may use during the procedure.
The procedure is best performed within the first or second day of life after the infant has urinated and has enough vitamin K in his system. During the procedure, the infant is placed on his back and held either manually or with a swaddling board. He will get an application of local anesthetic cream to the genital area. Nurses may offer a pacifier dipped in sucrose, aka sugar, to help soothe the infant. There are different options for procedures, but in this image, it is showing the Plastibell procedure, where an incision is made at the top of the foreskin as in image A, and then the Plastibell is placed over the head of the penis, and the foreskin is pulled over the Plastibell as seen in image B. And finally, a suture is tied around the foreskin over the tying groove in the Plastibell. The excess skin is trimmed, and the Plastibell falls off within 3 to 7 days. This is seen in image C. The circumcision appears red immediately post-op and should not have a strong odor or discharge. The child will be assessed for complications such as bleeding or infection about every 15 minutes for the first hour, and watched closely for the following 2 hours as well. The infant needs to urinate to show that the urethra is not blocked. Usually after the first or second day, a scab appears on the glands of the penis and should not be removed. The scab helps the site heal. It is a parent's duty to keep the area clean from feces and covered with petroleum jelly for 3 days. If any significant crying, redness, or tenderness is noted, the parent must call the provider because this might indicate an infection. So why get circumcised? There are medical benefits, social reasons, and religious beliefs. Beginning with medical benefits, scientific evidence shows that circumcision reduces the risk of HIV, HPV, and cancer in the male as well as cervical cancer in a female sexual partner. In addition, circumcision decreases the chances of UTIs, and this is because it is easier to maintain genital hygiene with the extra skin removed. Next, social reasons. Many families choose to have this procedure because all the other men in the family had it done. Families also do not want their son to feel different. Religious beliefs. This is common in the Muslim and Jewish religions. Now we will discuss some reasons of why not to get circumcised. Reasons such as surgical complications, it being a painful procedure, and contraindications.
Just like other procedures, there is always risk for complication. Some families may not choose circumcision because of complications such as bleeding, infection, or cutting the foreskin too short or too long. In addition, some parents opt out because of the painful procedure. Parents do not want their children to feel pain and ultimately choose to not have the circumcision done. And thirdly, some infants are actually contraindicated altogether from having a circumcision. Some of these include history of bleeding tendency in the family, micropenis, hypospadis, epispadis, and refusal of the vitamin K shot. What will be obtained before the procedure? What is next before the procedure? Ultimately, the choice is yours. But before the procedure can continue, you must give consent, and nurses will check to make sure that your child has been given a vitamin K shot before the procedure can continue. You get to make the decision. Current evidence from the American Academy of Pediatrics suggests health benefits for infant circumcision far outweigh the risks. However, they ultimately conclude that parents make the decision based on their own beliefs and wants.
Before this procedure can be done, a nurse's priority is to obtain consent from the parents. The parent will be fully educated on the pros and cons and given the time to make their decision. And once the decision has been made, the consent form will be signed and the procedure will take place.
Now let's talk about the vitamin K shot. Vitamin K shots are typically given within the first 24 hours of life, unless the parents refuse the shot. Newborns are born with small amounts of vitamin K in their system. So vitamin K is given to help newborns stop excessive bleeding, which is required when a circumcision is performed.
Top takeaways on circumcision. Number 1, get educated and ask questions. Number 2, figure out what works best for you and your family. And number 3, ultimately, the decision is yours.
Thank you for watching.